Generally, I'm really happy with the NHS. My family and my close-knit family have a lot of medical problems, and so generally I'm extremely happy with the NHS, especially the local hospitals. I think we've got a lot of things to offer. We have everything here. If you've got any sort of injury or anything, because I've used most of these units, so I'm extremely pleased.
After all on your nose as well? Yeah.
I really like the health clinics where you can take the babies in to be weighed, check that they're doing fine. I feel that helped me a lot when I was breastfeeding my own children, just to make sure that they were on par and doing as they should be doing. I enjoy the children's centres. I think that they're good as well. You get a lot of information and a lot of help and advice from the staff when you need it. The other thing that I used to really like was the walk-in doctor's surgery for the children. I think that was brilliant. Mm-hmm. Unfortunately, that's no longer. Mm-hmm. But they're the things that I liked the most.
Yeah, I mean, the the service is very well here in this area. Whenever I need appointment for her, especially for her, for childcare, yeah, it's like I have never struggled to get the appointment with the doctor. So yeah, that's a good thing actually.
I would certainly say the children wards at the hospitals, they are absolutely fantastic. I wouldn't like to localise that because I've seen programmes also on the TV about children's wards in other parts of the country, and they're just so friendly, so warm. They look after mum as well as looking after children, which is amazing, and it's something I've never expected. And they're so colourful and bright and cheery, and if you're ever going to donate, I think this would be a great cause to give to.
Well, I'm doing this thing called Care to Learn, which is where they pay for younger people to do it, and so they supply for Max to come here, which is really helpful and really good. And I always find the people here that work here are always really helpful, really, informative about what's going on, about what I need to do, because I was quite confused at the start. So I think they've been very helpful with, sorting out information about what to do and how to get them in and everything. So it's been quite good.
Brilliant.
I think the most annoying thing is the triage appointments. It's just always impossible to get an appointment. You phone up for an appointment and they say the doctor will phone you back. You get a phone call about 10 hours later and then he asks you to go in to see him. So it's really quite frustrating. What I think really did work, which was excellent, was when they had the drop-in clinics for children in the mornings. So you could just drop in before school. It worked really well, and if they could do some sort of system like that for everybody for the first couple of hours maybe, and you sit and wait, I think it would be really helpful for those small, in small little things you don't need to go and have a long-winded conversation about.
Great, thank you. So, if you were in charge of the NHS, what would you do, what would you change tomorrow?
It's very difficult. I know that they're very short of money, but I think the appointment system, the waiting, I personally have had to wait for a year or more for my hip, and I've been in excruciating pain, and I have had to wait and wait. And my problem has been, because I was in so much pain, I then had to go back to see the consultant. So then I was put back to the bottom of the list again because I'd been seen by him in the interim period. So it meant that I actually waited nearly 2.5 years, and I couldn't walk, and I was on morphine. I was in agony. So I think for me would be to reduce the times, but that is, I know that's maybe asking the impossible.
There are a few things, unfortunately. The drop of the walk-in children's clinic, which I thought was brilliant because it meant you could still get the children to school on time, or straight after school that surgery was open and available. It would made life so much easier. I don't like the fact that you now have to explain to the receptionist what is wrong with you before the doctor will even think about calling you back, which could potentially take anywhere between 5 minutes to 5 hours to get triaged to actually get an appointment. I find it very frustrating, especially as my day generally starts very early and finishes at like 6 o'clock at night. And by the time they phone back, I'm on the school run, then everyone in the playground is hearing what's wrong with me. My son was misdiagnosed by a local hospital. He'd actually broken his arm and we were told he'd torn his ligaments. It took me going back 3 times for them to actually get what was wrong right. And the other thing that I found very frustrating is, unfortunately, due to circumstances that I've been through, my son's needed therapy. It took me 6 months of fighting with a doctor continuously to even get him an appointment, and then he's been on a waiting list for 18 months before he's been seen. I find that very frustrating because if he had a broken arm, they'd cast it immediately and make it better. But for mental health problems, it's a whole different kettle of fish.
I don't know. Yeah, actually the staff and all like are very helping and very caring. But yeah, I feel some of the surgeries, they don't put children toys and all, so it will be helpful to keep them calm. If, yeah, it will really helpful if toys will be available, or yeah, doctor can give stickers, because usually children will be more attracted to all these treats. Yeah, so they don't get frightened with the surgery name or with doctor's name. Yeah, so they'll be calm if we take them to the nursery surgery. So yeah.
Quick, put it back.
She's even nearly ran in there.
Well done. Now can you see if you can put it back onto your head?
I would certainly say that I had a bad experience when I was breastfeeding, and that was due down. I wouldn't blame it on my health visitors, so to speak, but I think with more hindsight or experience, I don't know what the reason was, they could have helped me. I struggled and have since found that in Buckinghamshire advice varies to that in Oxfordshire, so perhaps the counties don't speak or they're trained differently, but I would have found it a lot more helpful if I'd been given the same advice, which was to use a certain teat for breastfeeding. That really would have helped me, and now looking back I feel really regretful that I wasn't given that information, whereas someone I know has, and they've been able to progress with it.
I had a very good midwife when I was obviously pregnant, so I was quite happy with her, but I did find that a few health visitors that I had weren't very, helpful to the needs of young mothers, which really upset me, and kind of made it a bit more stressful and a bit hard for me to connect with them about things that I was worried about, because I didn't want to seem a bit like I didn't know what I was doing because I was young. So I think sometimes it'd be good to train some health visitors, especially for young mums and stuff, because I had a midwife that was for young mums in the area, so it was really helpful having her. But maybe health visitors for young mums would be a good idea.
It's great. Thank you very much.
No problem.